all are well and welcome to this webinar. I'm Akansha, Project Manager at Rehab Path India, and we are a Madison-based startup with a mission to fight addiction. So we basically connect the patients and families to the right rehabilitation centers, and currently we are working with around 1,700 rehabilitation centers in India. So in today's webinar, we will be talking about evidence-based holistic treatment with Samarpan, and our speakers are Dr. Ashish Deshpande, who is a psychiatrist at Samarpan, and we have Rajnandini, who is a psychologist and is also a part of a team. So she will be basically driving the conversation for today's webinar, and it will be about our session. So please feel free to drop your questions on our Facebook and our Zoom page, and we will be taking the questions up at the end. So that will be the that is how we are going to proceed. So Rajnandini, over to you. You can go ahead.
Sure. Thank you so much, Akansha. Good evening, Dr. Deshpande. It's an honor to have you here with us. So I won't take too much time. I'll get to the questions quickly. So to begin with, could you tell us about yourself and a little bit about Samarpan, like what its value proposition is?
Yeah, well, I happen to be Dr. Ashish Deshpande. I'm a psychiatrist, and I'm associated with the problem of substance use disorder and treatment in India for the last 30 years. Probably I have traveled more than any other psychiatrist in India, right from Chandigarh to Kanyakumari, from Tinsukia to Surat, and through the interiors of India, trying to understand the difficulties that are faced by alcoholics and drug addicts in rural areas as well as urban. I have the benefit of being associated with the 12-step program for the last more than 30 years as a friend of Alcoholics Anonymous and Narcotic Anonymous, which are probably the most extensive reaching community resources in India. So again, my uniqueness is that probably I'm well versed with the medical aspect as well as the 12-step program. And that probably keeps me in a unique position to understand the problems faced by people who have substance use disorders as well as their treatment needs. So that's what I am. And I have been associated with Samarpan as a psychiatrist and in charge of the mental health branch of Samarpan for the last 2.5 years. And we have been working on developing the programs which would probably benefit the needy patients who are ready to do something about their substance use. So in Samarpan, we have a policy. There is no forced treatment. It is absolutely voluntary treatment. Yes, that's something which is very different from most of the rehabilitation centers. But we believe that the hope of wanting to give up is essential in the treatment of any kind of substance use disorders. And if there is that need to give up alcohol, then yes, the 12-step program and the medical interventions together offer the best recovery chance. So that's what we are trying to do. We are trying to get the best in the business all across the world in the treatment programs. We will not probably restrict ourselves to individual treatments, but we plan to go ahead with preventive programs also. And that's what I think defines Samarpan differently than most of the rehabilitation centers in India or abroad also.
Okay. Thank you so much for that introduction. And listening to your introduction, I'm very excited to have this conversation with you. So my next question would be, what is a typical day at Samarpan like? Like, are there any extracurricular activities that people would be interested in?
Yeah, we have two sites right now. One is the outpatient department, which is situated in South Bombay, Churchgate, very close to the station. Churchgate Station. And it is a proper outpatient department, where it's about 7,000 square foot of area and multiple facilities for all kinds of interventions. You name it and we have it. We see patients only by appointment. Unfortunately, because of COVID, we are restricting it to only telemedicine, because alcoholics and drug addicts belong to the vulnerable category when it comes to COVID patients. And we believe that health of our patients is the primary goal that we want to achieve. So we are currently operating telemedicine. We have a rehabilitation center, but as I said, that right now we are not operating the rehabilitation center, but we have about a footfall of 250 patients on telemedicine facility. And we have a place, it's ready, but during COVID times, we don't want to take a risk of starting a facility. So it is ready, the staff is ready, the resource people are ready. The whole team is ready to welcome patients at any moment. But most probably around Mahatma Gandhi's Jayanti, we would start our operations of our rehabilitation center.
Right. Okay. Yes, the pandemic has definitely changed the way we work, and everything is being done online. But hopefully, soon patients can start coming in and use all facilities. So, yeah, that kind of brings me to my next question. What, according to you, is the impact of the pandemic in terms of the rising numbers in addiction versus the footfall?
Yeah, in fact, during the lockdown, when all the businesses had halted, the only business probably that was growing was the business of illicit drugs. That was the only business that was growing because it was already illicit, and people were finding their drugs being delivered at pandemic has affected the substance use across the world. Initially in lockdowns, even availability of nicotine or availability of alcohol was affected. And even the illicit alcohol was not available. So people went through withdrawals and they did not have any hospital facilities for admission. So they suffered a lot. When they should have been allowed to take treatment, which was rightfully theirs, they suffered a lot. After the lockdown first lockdown got over and we started having some semblance of normalcy, you remember that the first time when the liquor shops opened, there were huge queues outside the liquor shops. I don't want to say that all of them were having substance use disorders, but people were bored and people did not know how to while away their time in the houses. And for millennia together, people have found that in such situations where there is boredom, tiredness, don't know how to pass time, people have resorted to psychoactive substances. And that's the reason why suddenly the sales of illicit drugs have increased. Because of that, domestic violences have increased, sexual abuse has increased, head injuries have increased. There is increasing transition from normal use to problem use. So there is a lot that is happening, and probably we would see the repercussions within a few years. What we are already seeing is a suicide pandemic. And if you see, most of the suicides that happen, they happen under the influence of substance use, because dying is not very easy. And once you consume substance, then dying probably becomes a little easier. So there is a suicide pandemic that is happening. Every day you see that there are people who have committed or accidental deaths in front of the trains. Okay, the railway accidents have suddenly increased. You see that people who seemingly are well placed in the society are committing suicides. Then there are celebrity suicides under the influence of substance use. So you're seeing this pandemic increasing over a period of days or months as we go into the extended lockdowns.
Right. Right, as you said, the number of addiction cases and even other mental health problems have been on the rise because of the pandemic. And the pandemic has also made it difficult for people to reach out and get help. So it's
Yes,
like both ways there is a problem.
yes.
Um, okay, so Doctor, my next question is how should one choose the right addiction recovery counselor? Like, what are the attributes to make the right choice?
Uh, well, see, in addiction counseling, there are probably two verticals. One is a health professional, and the other is community peer leader. Now, many a times people know that there is a health professional and they go to all kinds of health professionals for their medical complications. So if I have a liver problem, I would go to a hepatologist. If I have a head injury, I fracture a bone under the influence of alcohol, I go to an orthopedic surgeon. If I have gastritis, I go to a gastroenterologist or a physician, or just a family physician if I have one who is trustworthy. So that is one kind of resource that is regularly required by people who consume substances, because nearly 200 medical illnesses are triggered by nicotine and alcohol itself. Okay, so you can imagine that you name the disease and it could be associated with the substance use. The second resource that is required is the person who would understand that in spite of I having a liver problem, I can't stop. So it is as if I'm drinking to death, okay, and I'm not capable of stopping myself. So you're driving a car which doesn't have a brake system. So the brakes have failed. In such situations, a person who will assist you in leading you to use your mental brakes, okay, is a counselor who is called a de-addiction counselor. Now, this de-addiction counselor has to have knowledge of certain techniques in health sciences. There is screening and brief intervention, motivational enhancement techniques. Now, these techniques, when implemented, are able to convert a person who is in denial into acceptance in 80% of cases if it is given administered in early stages. Many a times the argument is these alcoholics, drug addicts just don't recover, because they don't recover because you catch them or you identify them or they come to the health sciences only when they are in the terminal stages. The simile is that if you have a cancer patient caught in stage 1 and stage 5, in stage 1, the recovery chances are high. In stage 5, the recovery chances are zero. So similar to that, even in substance use disorder, if you catch them young and early, the recovery chances are high. But unfortunately, most of the time, the addictions are not diagnosed in early stages. And there you require a mental health professional to diagnose these disorders in early stages. There is another group of people who can diagnose the mental health disorder in early stages, and that is community peer leader. Now, who is a community peer leader? A person who has lived through an addiction, has found a way of maintaining sobriety for himself or for herself, and has done some kind of a training either in community services or in mental health sciences, can become a community peer leader because of his self experiences and whatever capacity that the person has built. What is the technique that he should know? Genuinely speaking, let me tell you, all across the world, 100% of community peer leaders have done a 12-step program. So thorough knowledge of 12-step program of self-help groups called Alcoholics Anonymous or Narcotic Anonymous is something that is required. The 12-step call, as they call it, is nothing but the screening interventions and motivational enhancement techniques. So these are the two people who probably would be able to help. Now, whom do you select? You can't select one. Probably a person who is wanting to come out of his addiction would require both. But both should have sufficient knowledge of the fields that they see across the fence. So the community peer leader should have such sufficient knowledge of mental health sciences, and the mental health expert should have sufficient knowledge of the 12-step program. So when such combination happens, the outcomes are the best. The second thing is that you need to connect at mental level with the mental health professional or the community peer leader. So we call it rapport development. So you should be able to engage and be comfortable with that person in order to try to reach a stage where you would sustain your motivation to be away from your substance of abuse.
Right. So, like you said, so it's like a team that you require, and each of them should have knowledge about the whole process together.
Right.
Uh, okay, I think that was very informative for our listeners. Okay, so my next question is, what is the role of family in the recovery journey of an addict?
Yeah. We always say that this is a biopsychofamilial disease. Now, sometimes biological and psychological disease is very easy to understand because, as I said, that there is a impaired liver function, kidney function, aggravated diabetes. So you have paralytic strokes, you have lung infections, and they can be directly attributed to the substance. So you know what biological damage is. Psychological damage, well, you don't have to see anything. The behavior itself tells you that there is psychological damage. The person is not in control of himself or herself. The person when sober and the person when intoxicated are two different ways. It is like Jekyll and Hyde. But at the same time, the person after stopping drinking, there are some subtle changes that are observed by the family members. So in the olden times, they were called as character defects. But now we believe that they are not character defects. The same defects can be seen in people who do not have a substance use problem. But the same defects could be seen in a person who has a chronic alcohol or drug addiction problem. So what are they? Those problems are because of certain changes in the brain secondary to the chronic consumption and exposure of their brain to the substance of use. And these changes that happen probably sustain the addictive process or addiction as a disease. So these changes make the person vulnerable for relapses. So even if the patient wants to be away from the drug, he starts slipping again and again. Now, what happens is, imagine a situation, the person who is afflicted with this disease is continuously thinking about how he is going to procure his substance. Now, his family is so loving and so caring for the person is because this person is continuously looking for drugs. The family also starts looking after this person. So where has he gone? Whom is he meeting? What is he doing? Why is he late? So even the family members' lives start revolving around the person, and the person is revolving around. So it's like the solar system. The earth revolves around the sun, and the sun revolves around some other star in the galaxy. Okay. So everybody is revolving around the drugs. Now, may I ask you a question? Suppose you are driving a car and you find a road which has oil spill on it. Now, once your car goes on the oil spill, okay, you can't control it. You just can't control. That's the reason accidents happen. Now, you can't control the car at that time, okay, you are skidding. Now, if your family member who is not on that skidding road, but is on the proper road, okay, then what do you think? Will he be able to help you out if he's also in the car or on the same skidding road, or he's on a firma terra, okay, so firm land, okay. So what people don't understand is that because of the addiction, even the family members' thinking, feeling, and behavior is likely to be affected, which makes them incapable of helping their alcoholic or addict. Because once their thinking, feeling, and behavior is affected, they also land up on the same oil-spilled road, and they are also skidding. So two skidding people cannot help each other. That is where we say that relationship impairment that this disease causes leads to family issues and makes the family, who else in my life would be able to help me the best? It's my family. When I have a cold or I have a fracture or I have a loose motion, it's my family who caters to me. Here, the family becomes incapable of catering to the needs of the alcoholic and the addict. And that is where the familial disease starts. Now, what you need to understand, first and foremost, for family to be able to help their addict, the first thing that the family members have to do is that they have to get off this skidding road and they have to really stand firm on a road where they can help once the patient tries to seek help. So when it will happen, we don't know. But when it happens, the person has to be on a firm road to give the helping hand. And that again is provided by groups of family members of people who are suffering. So the suffering family members, they also need therapy if their patient has to get well. But don't even think that this treatment for the family members will help their family, the alcoholic, to get well. It is not for getting the patient well, but it is for the sanity of the family members. If they maintain sanity, then they would be in a position to help their alcoholic when the alcoholic or drug addict seeks help. So yes, the role is enormous and help is available, but the family members, just like an alcoholic or an addict, also could be in denial. They do not accept that they have a family problem, and they feel that either they are the cause, so they try to correct whatever they feel is they have done wrong. They try to cure or control the person's addiction by either forcefully implementing treatments or going after therapists who probably do not have the idea of what is happening. So that is where the disease continues to deteriorate.
Okay. Yeah. So definitely addiction does not just affect the individual, but also the relationships and the other individuals in his life. So in a way, they all have to work together to get better.
Yeah.
Okay, that makes sense. But in India, there is a lot of stigma associated with addiction. So is this like a major roadblock in the Indian context?
Well, I wouldn't say that only in India. It's all across the world that stigma for substance use disorder patients exists. In some countries, because of the work that people like you have done, the stigma is reducing. In India, yes, we are probably in the early stages of removing the stigma of mental health itself. So I think well begun is half done, and I've been told that you are associated with 1,700 rehabilitation centers. So I just hope that you continue to do work and remove the stigma from people's minds so that people are willing to take help without any hesitation.
Right. Yeah. Thank you so much. Yes. In fact, this webinar is also one step closer to that goal, like spreading more awareness. Okay. So about Samarpan again, do you follow any international guidelines to support your experience and clinical wisdom in the area of addiction recovery?
Yeah, I believe that a knowledgeable person is the one who knows what he doesn't know. Okay. And that is the reason why I try my best to be in touch with whatever that is happening in the frontiers of science in de-addiction services. Usually, the most authenticated websites for information on any kind of substance use are from National Institute of Health. US Health and Education Department has some documents published, and they have a few organizations: National Institute of Alcohol Abuse and Alcoholism, National Institute of Drug Abuse, NIDA. So these are the organizations which do phenomenal work, and they try to publish all the newest findings in treatment of all addictive disorders. Apart from that, there are some evidence-based interventions that are compiled in some reviews, which are meta-analysis. Usually, Cochrane reviews are the ones which have the maximum trustworthiness. So Cochrane reviews are the next in line that I would follow. The third is that there are evidence-based programs and policies document, which is published by these organizations. National Academy of Science, Education and Medicine publishes the latest information on all kinds of researches that is happening, including substance use disorders. So then there are private clinics like Johns Hopkins Medical Center, or there is Mayo Clinic. We plan at Samarpan, it's my dream that we should plan some kind of a treatment center which becomes a resource center for the Indian subcontinent or South Asian subcontinent. So that's my dream, and I'm working towards it.
Yes, that's good to know, and good luck on that journey.
Thank
So
you.
I have one I have one last question. After that, we can take questions from the audience. All right. So, does the recovery journey end once the patient leaves the rehab center, or so? What is the program at Samarpan like after rehabilitation?
Well, yeah, it's like, does the diabetes journey end after you leave the clinic of a diabetologist? Okay. The diabetologist is as good as prescription of drugs, okay, and he prescribes from the books. And once the diabetic patient goes home, what kind of lifestyle he follows and how he manages his urges for sugar, that is what finally decides whether his disease will be under control or it won't be under control. I think the same principle applies to many of the chronic medical illnesses also. It's not only substance use. Leave aside the accidental injuries and infective disorders. In most of the rest medical disorders, it is the lifestyle change which is a primary treatment modality. So it's not exclusively only for substance use disorders, but it's for all the non-infections and non-traumatic medical ailments which are chronic. You would have lifestyle change as as an intervention, which has to be followed for the rest of your life. So even for substance use disorders, stopping the drug or stopping the substance is probably 1% of the treatment. Okay, the remaining 99% is how to stay stopped. Okay, how to stay stopped is something that this disease people do not know, and learning that how to stay stopped is the treatment. And you could be 15 years sober, but if you just have one mishap, you are back to square one. Okay, so it is like snakes and ladders. Okay, the game of snakes and ladders. Okay, you go up to 99 and then the snake eats you and you are at point zero. Okay, so it's a very, very confusing, it's a very, very, I would say that intelligent disorder. And unless the patient understands what exactly he is dealing with, who is the enemy, how does he develop its own strategy, sobriety becomes very, very difficult and a long lost dream. So at Samarpan, I would say that we have a month-long program which starts after we prepare the person for the rehabilitation program. And after that, we have a hand-holding program for the next 3 months. So in all, it's a 3-month program that we have, wherein there are different sets of people who interact, but at the same time, the whole interaction is as a team. And that is something which is essential. So a person who greets the patient at the OPD, outpatient department, remains in touch with the person for whatever needs that the person would have till the time he is, he's never disengaged from treatment, but he's always in there to help that person for whatever needs that the person has. So we are trying to develop that kind of a trust-based relationship for a suffering alcoholic or a drug addict.
Okay, yeah, that does sound very helpful because I think a major part of de-addiction, a major goal is to prevent relapse,
Yes.
right? So okay, now we can go ahead and take some questions from the audience. So I have a question here. How do we know it's time to hit rehab?
How do you know it's time? Okay. Uh, there is one instrument called addiction severity index. Okay. Now, what addiction severity index tries to tell you is that how severely the biological aspect of the disease has increased. Now, in biological, it is the secondary effect of the drug on the body, and at the same time, the secondary effect of the drug on the brain systems also. So, what are the changes that we include in the biological system? So, we talk about tolerance. So, initially, the person used to consume a small amount, and then the amount started increasing for the same kind of effect that the person wanted. The second thing is that if it doesn't get the substance, how severe are the withdrawals? Okay. So the disturbance or distress that the person experiences if he doesn't consume the drug is called the withdrawal syndrome. How severe is the withdrawal syndrome? The third thing is that whether the withdrawal is complicated. That means if the person goes into delirium or the person goes into a fit stage, okay, where the person keeps having repeated convulsions. So we call it rum fits or alcohol withdrawal seizures. To complicate the matter more, just like withdrawals and associated mental illnesses, which could be anxiety disorder, psychosis, depression, any psychiatric illness can be mimicked by the alcohol intoxication or withdrawal. What is important is that if the person has these complicated alcohol related states, then the person needs to go for a detoxification within a hospital. Okay. Now, the other reasons for hospitalization are that if the person's liver is bad, his diabetes is uncontrolled, his blood pressure is uncontrolled, if he has any other medical problem, which would probably create extra risk for the detoxification. If all these factors are not there, then nearly 85% of alcohol withdrawals can be managed from home. They don't require a change of place for the person. The best place to go through a withdrawal is your own sweet home. Because if you are able to control your urges from your house, then half the battle is won. In a restricted environment, if you conduct the withdrawals, then obviously you don't know whether at home what he would do. So the best place to conduct withdrawals is detoxification, that is the process of removing the toxin from the body, is home. Now the question is that does these things require mandate that he should go into a rehabilitation center? No. Detoxification, if successful from domiciliary basis, then the rehabilitation program also should be tried first from the residential house. Okay. If for some reason the person is not able to remain sober after repeated efforts at domiciliary rehabilitation, the reason why it happens is post-acute withdrawal syndrome. So what are post-acute withdrawal syndromes? Usually the withdrawal syndromes get over, acute withdrawal syndromes get over in 10 months to 10 days to a month. Nicotine being the slowest, okay, most lazy. So nicotine withdrawals take about 3 to 4 weeks. Otherwise, most of the drugs withdrawals get over in about 10 days or around. Now, post-acute withdrawal syndromes are temporary withdrawals which come beyond the period of 1 month and can extend up to 1 year with severe intensity. After 1 year, the intensity starts dropping down. And after 3 years, most of the times, alcohol-related post-acute withdrawal syndromes are likely to be manageable. So if a person has strong post-acute withdrawal syndromes, then he requires to be in a restricted and he has an intent. So he's struggling to remain sober. Okay. And voluntarily, if he gets into a rehabilitation center, then he can be there in the rehabilitation center for a substantially extended period of time till we develop his coping skills and give him reassurance and bring about community changes that are required. So family therapy, community connect with Alcoholics Anonymous or Narcotic Anonymous, he can be discharged after the rehabilitation course. There are certain situations when rehabilitation center becomes mandatory after detoxification, or sometimes even the detoxification has to be done in a rehabilitation center. When is that? When there are psychiatric complications associated with alcoholism, that is one. Second is the person is either suicidal or homicidal, or he has recurrent unlawful behaviors. So if these three conditions are there, then the person has to be taken for an extended period of time in a place where his brain can be away from substance, so that we can reason out with him about what he is doing with his life. So Mental Health Care Act 2017 mandates that suicidal patients, homicidal patients, or recurrent unlawful behavior showing patients have to be kept in a place where you give them an opportunity to think right about their life and take decisions which would be good for them. So these are the reasons when you can. But if the person is economically affected, the person has family relationships affected, and the family has problems which probably could keep triggering the relapses, then the person needs to go into a rehabilitation facility. So this addiction severity index tries to tell us whether the person requires some kind of an extended rehabilitation facility or not. But most often, voluntary treatments given in the residential premises have the best outcomes.
Okay, right. That was a very informative. I think there are many aspects that people have to look into when they're questioning whether they need a rehabilitation center or not. So I think you have sort of covered the answer for the next question as well, but I'll still ask. Is self-recovery with tapering possible? Will we need any medication?
With tapering? Self-recovery with tapering? Yeah. Addictive substances are of different types. Okay, they are absolutely of different types. Most of the treatment programs try to emphasize on complete sobriety. Okay. Now, in order that the brain comes to that stage of accepting complete sobriety, sometimes the patients require time. And when they require time, the best that can be offered is that if the person can reduce the consumption, the amounts that he's consuming. Unfortunately, all these chemical compounds that are consumed for their psychoactive effects, they have differential properties. So for instance, nicotine, you can taper, okay? But alcohol and most of the synthetic drugs and the herbal drugs, it is very difficult to taper, okay? It also depends on how vulnerable your body is to that particular drug. Okay, so I have seen that some people who are chain smokers, they just can't tolerate small amounts also. Even if they go to a room where somebody has smoked maybe 1 hour back, the intense craving can come. So there can be such huge vulnerability, or there might be a person who is a chain smoker, stops smoking, follows the treatment protocols, and then even if his friend smokes in front of him, he is able to control his urges. So whether to taper or not, okay, is something that the person has to try it out. But if tapering doesn't work in you, then obviously you have to take the truth right, standing naked in front of you. You have to take it and say that, yes, tapering is not helping. I need to go cold turkey. So that kind of real readiness for realization has to be there if the option of tapering is offered to the patient.
Okay. So doing a little bit of an experiment in their recovery journey is okay, but they have to face the facts and be realistic about how it's helping them. Right. Yeah. So in that way, it's best to seek help. Yeah.
Sometimes that becomes the clinical test to find out whether you have dependence or not. Okay, just tell the person that, okay, you believe that you are just consuming excessively and you would like to moderate the amounts. Try it out and meet me after 15 days and tell me what your experience has been. Okay, if he doesn't have addiction, it is just problem use. Okay, then he is able to taper. But if he has addiction, believe me, he will not be able to taper. In 15 days time, either his consumption will increase or he will never show his face to you.
Right, right. Like you also said before, that addiction comes with a lot of other comorbidities. So, of course, there are other problems also to deal with. Okay, so let's go to our next question. So, someone has asked, for a middle class person with a limited budget, will I have higher chances of recovery in a luxury rehab? So, I think
Well,
they're asking if it's worth it. Yeah.
yeah, I know. See, the cost effectiveness of the treatment, okay, is something that has been a question in the minds of people. Now, for instance, for heart attacks, the costs are exuberant, but people take those treatments because the number needed to treat. Okay, so of the number of people who take treatment, how many get better? Okay, that number is pretty high. Okay, uh, in substance use disorders, okay, that number unfortunately is not that high. So the chances of relapses are pretty high. So in such circumstances, yes, certainly we need to think what kind of rehabilitation center would you want to go. Okay, and my suggestion to that person is that for treatment, the patient requires comfort. Now, what you define as comfort is something that each family would have his own resources and would decide. Okay, so for instance, whether to sleep in under a fan or in an AC or centrally air-conditioned place, on what kind of mattress, all depends on your financial resources. So you cannot go beyond your financial resources and take treatment, because that would you would be, writing your doom. Okay, because in treatment you would be probably collapsing the whole financial infrastructure that is required for the betterment of your family. So I certainly wouldn't say that if your budgets are less, then you should go for a luxury um, place. But certainly I would say that go for a place which has a mental health care act license to work, and has a mental health professional associated with the facility, with whom you can talk before going to the rehabilitation center and you find that you are comfortable with. Go to and meet the community peer leader who is in charge of the 12-step program of that facility. See to it that he answers all your queries patiently. Okay, he doesn't, disregard any of your questions. The next thing that you have to do is that you have to find out whether there are any recoveries, whether they associate themselves with the rehabilitation facility, whether there are any aftercare programs. So after rehabilitation, whether the patients feel like associating with the rehabilitation center. What kind of aftercare programs are there? What kind of relationships are developed between the care providers and care seekers? So if you find out this information, then you would find a place where your alcoholic or a drug addict can most likely recover.
Okay, thank you for sharing that information. Yeah, like you said, I think having comfort is important in the journey of recovery, because we don't want that discomfort to become a hindrance in their
So
the addiction.
rehabilitation center is not a punitive treatment; it is a curative treatment. And
Mm.
for curative treatment, you have to have basic comforts and basic hygiene and basic respect.
Right. Okay, so the next question is there an option for one of the family members to stay along with the person admitted in the rehab if there is a need?
Well, in the current scenario, no, because of social distancing that we need to have. Most of the rehab centers are working 50% occupancy. Um, uh, Sometimes what happens is that the circumstances at home are the trigger factors for repetitive relapses. Okay. So as I said, that the transactions that happen between you and your close one, if that becomes a reason for relapse, then what do you think? If the person with whom you have those problematic transactions is still hovering around you during the times of recovery, would it aid or would it hamper the recovery? Most often, in a short course of rehabilitation center, we always advocate that the families should come and should be allowed to meet the patient um, uh, as many times as possible, as allowed by the uh, logistics of the treatment providers. Okay. So it should not be something like a jail where the family has to write in triplicate and find out when they can meet their family member. Okay, I don't think that's the right nice. It's like intensive care unit. You understand that in intensive care unit, the family members are not allowed to see the patient repeatedly because of the risk of infections. So here, because of risk of exaggeration of emotions, exacerbation of emotions, the patient and the family needs some separate time. Okay, they need some me time, as your generation would say. Okay, they need some me time for their emotions to cool down their heels. Okay, and then of course we want the happy family to be together for the rest of their lives with sobriety, bonding them together.
Right, right. Like we already spoke that family has a major role, but definitely having some space to deal with their own emotions is also important.
Yeah.
So we have sort of already covered this, but the question is, in the times of social distancing, how have you managed to extend care to the patients? What are the services that are available? Yeah.
Well, we have developed everything that we used to do face to face on e-platform. So we have first consultations, follow-up consultations, all kinds of individual therapies, group therapies for patients, group therapies for family members. Everything has been developed on e-platforms. In fact, we also have a group therapy to facilitate acceptance of 12-step program for early recoveries. So sometimes the 12-step program can be a little perplexing for a novice. Okay, a newcomer always finds that, or maybe person who has early stage disease. As I said, that early stage disease interventions reap enormous success. But the early stage disease person, when he goes and attends a 12-step program, he finds that he is in an odd place. He doesn't belong here because he has never hit his wife, he has never hit his children, he has never fallen on the streets. And he finds that suddenly he is exposed to a people who have committed murders and committed crimes and everything. So he doesn't want to associate with that. So we have to make them ready to find out why they are attending the group therapy, the 12-step program. So that is called the 12-step facilitation group. And we already have the 12-step facilitation group in place also. So the COVID, well, be not proud. We are on e-platform doing everything that we were doing in physical clinics.
Okay, yeah, that's good to know. Uh, so it starts with awareness, and I think that's very important to start the whole process. Okay, let's take one last question. So someone's asked, what's the approximate fees for 3 months of rehabilitation?
Well, that you have to ask the administration. I have no idea about the charging. I'm that kind of a person who has no knowledge of the finances.
All
And
right,
I am
thank you so
talking very
much.
honestly. I am very, very honest about it.
Yeah, we appreciate that. Thank you so much. This whole session was very, very informative. So now I will hand it over to Akansha for the vote of thanks.
Thank you so much, Rajnandini, and thank you so much, Dr. Deshpande. It was a very insightful session, and I'm sure it will be a lot of help to our people in our network. And so, before we conclude, Dr. Deshpande, do you have any message as a psychiatrist for the audience, like in this pandemic situation, or any general message which you would like to share?
My only message to the audience is that remove the stigma of mental illnesses from the Indian mind in whatever way that you can. That would be a great duty to the country. The second thing is that if there is any suffering alcoholic or drug addict in your neighborhood, in your family, or maybe you yourself, okay, do not hesitate to take help. The help is available. Okay, it need not be an expensive program or luxury place that you would want to be, but just seek help. Just seek help. Okay, and it works. Okay, there is a 12-step program which is there, has the maximum reach. To understand the nuances of 12-step program, yes, there are mental health people who would be able to help, but ask for help and you shall get it. Okay, do not try to solve the problem yourself. Okay, take help and you will be all right.
Thank you so much, Dr. Deshpande, for such a great message. And thank you once again to both of you. It was really great having both of you today. And I'm sure everybody, our audience, has enjoyed the session. I personally enjoyed it a lot. And thank you so much once again. And soon we will be back with another webinar. Until then, stay safe and have a great weekend ahead. So, bye bye, Dr. Deshpande.
Thanks, Rajnandini. You made this conversation so interesting.
Right, definitely.
Thank you. Thank you so much.
Thank you so much. Thank you so much, both of you.
Okay.
Bye bye.
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 Bye bye.